everyone, and thank you for joining us. My name is Ashley McDermott. I am with the AIUM, and I will be your host. As part of our continuing education for healthcare professionals, I am pleased to host this webinar, Complex Hearts, Smart Fetal Cardiac Imaging, presented by Dr. Elena Sinkoviskaya. This is a non-CME educational activity in collaboration with Samsung. This webinar will explore how AI is revolutionizing perinatal ultrasound, from automating fetal measurements to detecting anomalies. Learn how these innovations are being integrated into clinical practice to boost diagnostic precision and enhance patient outcomes. If you have questions for the presenter during this webinar, you may type them into the Q&A box. You will be able to submit questions throughout this webinar, but the presenter will not begin addressing them until she has completed her presentation. This webinar is being recorded, and you will receive a follow-up email within 24 to 48 hours with a link to view the recording. And now I am pleased to present Dr. Sinkoviskaya.
Thank you very much. It's my pleasure to be here tonight and share our experience in the fetal cardiac imaging. So once again, welcome everybody. In the next 45 minutes, we are going to review the very important aspects of the cardiac imaging. And I would like to highlight, in order to achieve the best clinical results, we need to make sure that we follow the national clinical guidelines for the cardiac imaging performance that generously provided by the American Institute of Ultrasound and Medicine for many years for clinicians to guide their clinical practice, and also equally important to be familiar with the latest and greatest technologies available from our partners in the Samsung Healthcare. And today we are going to overview the newest development on the ultrasound technologies, and also I will clearly demonstrate to you how those technologies can be applied in the clinical settings in order to be compliant with the clinical guidelines for performance of the fetal cardiac imaging. And at the end, I'm going to show you a few clinical cases, and we will see how those new technologies help us on the daily basis to solve the very difficult and complex situations that may include the fetal hearts. So, but before we're gonna go into the a lot of details, I would like to start from this image, because the technical component of the cardiac imaging is very, very important for us. And I would like to highlight that even though on this image you can clearly see the cross-section of the fetal chest, the heart beating, should not be looked at in terms of the clinical evaluation, because first, this image requires a lot of work to optimize to be acceptable for the clinical judgment. And if we start from the foundation of the cardiac imaging, our goal is to achieve the highest frame rate possible. And so for that, there is several controls that you need to be familiar with to adjust them on the daily basis from case to case to make sure that your image is optimal. And here is the frequency, the depth, the sector width, the focal zone, the gain, and the appropriate magnification. If you adjust all those parameters correctly, so the result of those optimization can be seen here. And we are moving from this image where the structures are very small to this image where the area of the interest, which is the fetal heart and the fetal chest, takes majority of the screen. And here we we can see that the highest resolution possible, including the axial and the temporal resolution, the structures that we need to look at. And is it well known that the cardiac anatomy is very, very complex? And then we deal with the abnormalities that are described more than 200 different types of the cardiac malformations. Some of them are less complex, others are more complex, but in order to make the exact and precise diagnosis, we need to make sure that we optimize the image correctly. It's not always the very easy task, and I'm going to show you how the new tools, the new development in the ultrasound technology, including the physics of the beam forming, can help us to overcome all those difficulties. First, I would like to share with you that the recent advances in the physics of ultrasound help us to get rid of one of the controls. So basically, most of the modern systems, including the ultrasound from Samsung, has the electronic beam forming and focusing, so that doesn't really require any focal zone. In other words, we would usually place the focal zone in the area around here where we would want the beam be the most focused. This is the area of interest. But as you can see on this image, so the image actually has the best resolution from top to the bottom. And the placement of the focal zone is actually not possible anymore. So you cannot really see that control. So that is the greatest achievement. And actually, from the standpoint of the physics of the ultrasound, this is a revolutionary step. So, but what about the other controls and the other tools that we have to improve the image and the visualization of the cardiac structures? Here there is the same picture, and you can see if you read this controls over there. So this is taken using the same preset, the same probe, the same depth, the same frame rate, and all the other parameters of the 2D imaging. And here I would like to introduce to you the concept of the different tools that we have that help us to change the perception of the image and also to change the appearance of the very teeny tiny details that can be recognized looking at the heart, including the leaflets and the papillary muscles, the foraminal valley, all those details that we need to look at, then we perform the detailed assessment of the heart. So how can we jump from this image, which is our best image possible? You can see that historically the pediatric cardiologists like the image being a little bit grainy, shows pretty well all the structures we are looking at. But how can we jump to this one that shows even better resolution of all those details? So here we have a lot of advanced technologies, and in particular the post-processing technologies that allows us to do what is really demonstrated on this picture. So this is the girl who just woke up in the morning, so nothing really tells us about her that she is the film star. But once she goes through her morning and put the makeup on, so this is where we can see that this is a real star. So all those technologies of the post-processing, including those which are highlighted here, and we are going to expand a little bit more on the next few slides on those, helps us to do pretty much the same with our ultrasound image. So it can be used live, but it also can be used after you push freeze, and that help us to improve the quality of the image. This is in particular important when we are talking about patients with the very difficult scanning conditions, and you probably know how hard it is to do the sophisticated assessment of the heart when the patient has a higher BMI, had this prior surgeries on the abdominal wall, and the other issues. So here is the example how we can take the native image, and first we will apply the clear vision and the multi-vision technology, and it sharpens the edges of the image and also takes a lot of speckles and noises away. Then we can apply the luminance software. This is the software that gives the 3D appearance on the 2D image. Then we are scanning just using 2D probe. And finally, we can apply the chroma map, and that is this also helps us to improve the resolution and the imaging, because in the shades of color we can see and we can recognize the shades of color much better than the shades of gray. So this is how pushing just basically 4 buttons on the touch screen, you can improve your image dramatically. And again, it can be done as the post-processing. So this is just to highlight that the Luminant Flow, this is a new technology that gives the 3D appearance of the 2D image without switching to 3D technology. So, and it helps to highlight the details on the contours of the myocardium, in particular here in the 3-vessel trachea view, and the certain structures, they kind of pop up from the plane, and this is really improves the ability to see the details. So the next thing that I would like to talk about, this is also related to the technical considerations that we are doing fetal echocardiogram. This is a different presets and a different approach to the preset. So most of those technologies that we just highlighted can be embedded in the preset. And indeed, once you switch to the fetal heart, all of them can be automatically activated so that you don't really need to have the extra strokes, so extra thought about how you can improve this image. So that can be created and customized the way you want it. So the other important aspect of the image optimization is also the fact that many of you are familiar with the Q-scan button or the auto automation and optimization button. So that one now took a different level, so that in the past we were able to push the auto optimization button once, and then we will have to do it again or readjust the presets manually. But now we can actually have that working on the background as the live option, and the ultrasound system will readjust every time the scanning condition once they got changed. So this is also a very important feature, and if you didn't try it before, so that quick auto optimization is a really important feature. But also the new concept is applied to the presets themselves. We all very well know that sometimes you need to be opportunistic so that the baby shows the brain better, and then all of a sudden you have to jump to the heart. So you can really to be within the same preset and go to the sub presets that design specifically for the certain fetal organs, including the brain, extremity, spine, abdomen, and the fetal heart itself. And that technology is specific for Samsung ultrasound equipment. It's called the Easy Structure. So for example, I'm scanning this beautiful heart, but baby just turned and showed me the brain. So I can actually activate the brain preset. And all of those presets, they are highly customizable. And as you can see here, you can adjust all those parameters that improving the visualization in the 2D that can be customized per probe, per application, and per preset. So basically, we never leaving the second trimester preset or the third trimester preset. We just tuning it a little bit more precisely depending on what organ we are looking at. And if you think about that, this is something that we always do. Then we scan the adults and children. So for example, within the abdominal preset, we have the preset for kidneys, for liver. So this is the same concept, but applied to the fetal imaging. So also the workflow matters. Sometimes you see all those buttons, you look at the keyboard of the ultrasound system and you feel that you're in the space shuttle or you got lost. So, and I just want to highlight for you, there are certain tasks that the workflow requires that you don't really like much. So here is the required imaging in the fetal echocardiogram that you can obtain. And as you can see, this is all the views that constitutes the fetal echocardiogram protocol. But ideally, they all need to be labeled. And also that would be very helpful to label all the anatomical landmarks to ensure that the quality of the each view. So here you have the personal assistant that is called the view assist, that basically helps automatically label the view and all the anatomical landmarks. And as soon as this technology is based on the artificial intelligence, it really helps to streamline every single exam. And even if in the past you didn't really have a habit to highlight and to label every single picture that's in your exam, now it becomes really easy and takes less than a second. So here is an example. This is where all our fetal imaging of the heart supposed to begin. And this is the upper abdominal level where we look at the situs and we look at the distribution of the different structures that helps us to identify the situs. And you can clearly see the portal sinus here, the inferior vena cava, the aorta, the spine. And once you freeze and ask for your personal view assist program to put the auto annotations, so that would be automatically performed. So you know that this is the abdominal circumference, the reader of your exam knows why this picture was taken, and then you can see the umbilical vein labeled, the stomach, and the spine. So that is really important, not just for the person who performs the scan, but for those who reads them too. So, but the View Assist was really developed lately even further, and this is due to the artificial intelligence technologies that basically helps automatically label the pictures, identify what they are showing in the real time, and then perform all the measurements and labeling of the structures. At the same time, it may occur without you even noticing that because that happens on the background. So you may turn it on or turn it off. And here is my personal example. And this is the patient who was scanned by my first year resident. And the resident was on her ultrasound rotation. And this person spent just 3 hours in ultrasound unit. So this is basically no experience in ultrasound at all. So here you can see that we are doing the assessment of the axial planes of the fetus. We are moving from the 4-chamber view to the 3-vessel and trachea view. The resident doesn't really look at the keyboard, doesn't touch anything. The idea is to get the orientation. But if you look at the panel here, you will be able to see that how many views were already automatically recognized by your personal assistant, by the Live View Assist. And all of those images were labeled. And if you will look into them, so here is the example of the images which are automatically recognized, captured, labeled, and saved by the system. And you can see that for the cardiac screening, for example, it's pretty amazing. In particular, then we are dealing with very novice operator. So this is a really interesting technology that from my perspective cannot just be the tool for the quality assurance of your scans, but also could have a lot of potential for the education in the field of the cardiac imaging. So what are the other tasks that we have using the imaging in 2D? This is the cardiac biometry. Most of the cardiac biometry is not required by the fetal echocardiography protocol, but the recent change in the fetal echocardiography parameter by AIOM requires the measurement of the annuli of the 4 cardiac valves. And here you can see the automatic measurement of the annulus of the aortic valve. And I would like also to highlight here that not just the measurement performed, but also we have the tool for interpretation that demonstrates here the percentile or the z-score that also help you not just to look at that particular absolute measurement, but also to have the understanding where that measurement falls in terms of the normal ranges. That helps the interpretation of those findings right away. So speaking about the performing the measurements, so this is the general considerations that you need to follow. We already talked about the magnification, how important it is, that the diameters of the valves, and this is again the mandatory component of the fetal echocardiogram by AIM parameter, so that the diameters of the valves and vessels, they should be measured at the moment of the maximum expansion. So the mitral and tricuspid valves should be measured in diastole and the aortic and the pulmonary valve in systole. So if you look at the diameters, and that includes the additional measurements, diameters of the great vessel, so you need to make sure that that measurement occur perpendicular to the long axis of the vessel. You also need to make sure that you perform the inner edge measurement of the vessel or the valve diameter, and also you perform the leading edge to the leading edge if you measure the myocardial thickness, for example, of the interventricular septum. So, and also we can take the measurement of the general or overall size of the heart in relationship to the size of the chest, that called the cardiothoracic area ratio. And again, that measurement can be automated, and you need just to put one button and the system will do it for you in a split of a second. So that a lot of artificial intelligence and automation and optimization can help us to streamline those exams and really focus not on this tedious task, but more interesting things. So color Doppler imaging. So this is another very much essential and required part of the echocardiogram in the fetal cardiac imaging. And as you can see that color Doppler has a lot of modalities that are presented here. It could be the conventional color Doppler, the power Doppler that allows to detect the direction of the blood flow. It's called the S flow. Or then the blood flow has a very low velocity characteristics, for example, in the pulmonary veins or in the different organs like kidneys. So then you need the microvasculature presets, and that would be the best choice to use the MV flow. So all of those blood color Doppler modalities can be used in combination with the LumiFlow. This is a technology that gives the flow the 3D appearance, similar to the luminant flow that gives the 3D appearance to the 2D imaging. So here the color will be looking and popping up over the 2D image and looks more like 3D. And then we can use the regular 3D of combination of the 2D and the color. And then the separate type of color that we are going to talk about a little bit later in regards to the assessment of the cardiac function is the tissue Doppler. So here you can see how diverse the Doppler technologies are and how important to use them cautiously and appropriately for the certain vascular regions. Here is an example of the Doppler imaging that shows the utilization of the LumiFlow and that 3D appearance. Here the image showing color is very flat, and here it has 3D appearance, but I would like to highlight that the new development of the color, so showing very great technique that allows to eliminate the bleeding artifacts and some noises. So in other words, the color stays in the vessel very precisely. So LumiFlow imaging can be combined with any type of the color, including the S flow or the conventional flow. This is probably the most common applications. So, and as we said, the microvascular flow or the MV flow is in particular helpful. Then we are looking at the pulmonary circulation, in particular pulmonary veins, and then we are looking at the vasculature of the liver, which is very complex and includes the umbilical vein system, the portal vein system, ductus venosus, hepatic veins, and this is something that is really useful to apply, especially when you're scanning fetuses prior to 20 weeks gestation. So as I said, that any type of color can be combined with the 3D imaging, and it could be the thin static 3D acquisition or the stick technology. And here you can see how the vasculature of the liver, again, this is a very important thing to look at because some malformations may involve the system, and it's a lot of different structures so that the 3D helps the spatial orientation between them. So this is like the application for the most of the time I apply imaging using 3D and color for the evaluation of the anomalies of the umbilical portohepatic system. So we can also reconstruct the vasculature of the different organs. So this is the baby's kidney, shows a very good perfusion of the normal kidney. And this is the perfusion of the spleen, which is huge because this baby has the CV infection. So we also have a lot of research in our department going on in the evaluation of the placenta and placental imaging. And again, those technologies can be used for that. So another very important advances that I would like to highlight, this is a pulse wave Doppler. As you know, the pulse wave Doppler is the mandatory component of the fetal echocardiography, so that we need to document using this technique the blood flow across all cardiac valves and in the pulmonary veins. And I just want to show you that the clear vision, this is a technology that eliminates noises and actively used for the optimization of 2D image, also can be applied to the optimization of the trace obtained at the PV flow. Here you can see the native image, and this is the application of the clear vision. You can see how stronger the signal gets and how defined the trace is, which is really helpful, especially if you're using the automatic trace technique, so that it's very precise and accurate. So what do we need to look at using color Doppler? So here you can see the main anatomical landmarks and the areas that should be evaluated using color Doppler within the fetal echocardiogram. But what I would like to highlight the most, that different presets are required for assessment, for example, intracardiac flow and the pulmonary veins. So the same if you will look at the heart not utilizing the fetal cardiac preset, and you don't really want to move far away from your general OB imaging, there is the improvement of the workflow optimization that you can actually change the preset for the color along without changing the preset for the 2D image. And for that, we have the technology that also called easy flow. What does it mean? So that this is something that needs to be evaluated and can be applied for the color Doppler or the spectral Doppler, including the pulse wave. So here, similar to the easy structure, the easy flow adjusts the preset specifically for the vessel that you're going to look at. It has the presets specifically designed, and they are fully customizable for each type of the flow per each anatomical structure. So here we have the preset for the uterine arteries. They're not very often utilized in the United States, but what is really used a lot is the MCA and the umbilical artery, ductus venosus, and here on the bottom is the heart itself and the pulmonary veins. And just want to show you the few examples. This is the image that we are starting with, and this just utilizing the one button click, so you can move to this image that has a much better resolution of the spectral Doppler, you know, the spacing between the cycles and the automatic measurements applied. The same we can apply for the assessment of the middle cerebral artery again, so that we are going from this not really optimized spectrum where you wish to adjust the scale so that you can see really much better the each cardiac cycle. You want to adjust the sweep speed. So all of this can be done utilizing the easy flow parameters, the same for the uterine artery Doppler. And again, if you are not very familiar how to obtain that flows, that would be very educational technique. So, but how about the cardiac Doppler image optimization? So we have two opposite situations. We have the blood flow across the valves. This is where we need the high velocity scale, high wall filter, low gain, and low color persistence. And for the pulmonary veins, because this blood flows velocities are really slow here, they need everything opposite. So like if you don't really have the optimization and automation of the workflow, so So you have to adjust at least 4 controls to jump between the assessment of the valves and the pulmonary veins utilizing colored Doppler, and as well as the spectral Doppler. And here you can see how the easy flow helps you to go from just the assessment of the valves to the assessment of the pulmonary veins, either the big, you know, change in the presets. And also the same can be done then we are looking at the pulmonary veins using the pulse rate Doppler, and you can see how much that saves the time for optimization, because to the moment that you adjust 4 or 5 controls, baby most likely already changed position. And for those who do a lot of exams on the twins, in particular if they are monodi twins, so this is also very helpful tool because helps you to catch the certain position of the baby and get the clinical information and move on to the next day. So the Doppler imaging, including the tissue Doppler. So this is the modality that's also available for us. And the 2 clinical applications of this technique include the assessment of the cardiac function and the assessment for fetal arrhythmia. So for example, then the baby is positioned in this apical 4-chamber view orientation, so that most of the time, all of the M mode placement and attempt to place the M mode through the myocardium of the left ventricle and the right atrium, or the myocardium of the right ventricle and the left atrium, so that you can simultaneously visualize the beats from the ventricular and the atrial locations. So they're not going to be very visible and not really informative. So for that, I usually use the spectral Doppler and the tissue Doppler modality that allows me to visualize each cardiac cycle that presented here. So basically this curve demonstrates the myocardial velocities, not the intracardiac velocities. And they have the similar pattern. So there is the myocardial movement during diastolates from here to here. So early diastolic and the movement of the myocardium during atrial contraction. And then there is the systolic phase where the heart moving towards the apex, and that's why it's like directed towards the probe. So in looking at those cardiac cycles, you can evaluate the atrial contractions and the contractions of the ventricle and see that they are associated and judge the rhythm. So, but then we talk about assessment of the rhythm and the cardiac function. I think that the first thing that occurs to your mind, and this is what the guideline says, that we need to, the method of choice and the first choice should be the M mode, our old good tool. But if you have any experience with that modality, you're probably well aware that this is not that easy to obtain this technique to get the meaningful trace. Usually it's very small, it's not readable. So what's the key optimization steps here? So if we are looking at the optimization, we need to start from the optimization of the 2D. And one of the controls that we are using when we're optimizing image in 2D is the zoom. So in order to get the best M mode, you need to make sure that your zoom box has just the heart, no chest, no other structures. So this way, then you apply zoom the way that you magnify the heart like that. Then you can drop the line of the M mode and you can see the nice excursion of the walls and the interventricular septum. And this is the greatest picture to look at the measurements that can be obtained for the assessment of the size of the ventricles and the measurement of the myocardium and systole and diastole. But if you go assessment of the rhythm, now we have the ability to drop 2 cursors of the M mode, and this is really helpful because then the heart is in this axial orientation. You can drop 1 line across the ventricles and 1 line across the atria, and you can see that the motion of the myocardium in this direction. So that's going to show the highest amplitude. So this is what you can see on that trace. And this is really important, in particular, then you look at the atrial contractions. And then we can look at the two atrial contractions, take the measurement of the heart rate between two atrial contractions, and then in the same cardiac cycles, we can identify the ventricular contractions. So they're going to be shifted in time in relationship to the contraction of the atria. So in here, you can see that the measurement should be pretty much the same, that this way you can demonstrate not just the heart rate, but also the rhythm. And that's really important difference, because then if you look at the heart rate, it doesn't really tell us anything if the atrial and ventricular contractions are actually associated. And this is very important. Important to document that it's normal, and important to for differential diagnosis of different anomalies of the cardiac rhythm. So, but if you have a task to look at the cardiac function, so the main limitation of the M mode is the impossibility to find the specific spot where the systole ends and diastole begins. So that's why you can use the combination of the M mode and the tissue Doppler, and you will solve this problem, because you know the change in color will specifically indicate the time where you need to perform the measurement of the three walls and, myocardium of the interventricular septum. So, but if we are expanding on the imaging of the cardiac function, I also want to show you how the latest technologies, which are coming soon to the United States, so can be simplified with use of the automation and the artificial intelligence. So the strain imaging, this is a technique very advanced, and this is in our guidelines. This is like required if it's not required, it's an optional for and reserved for the certain clinical situations. So here I would like to show you how you can simplify that. And indeed, this is again one button solution. So this is technology called the Easy HQ. So here I activated with that one button. So, and you can see that this is the data is being converted. And then you can really appreciate how much data I can identify about, the functional state of this heart. So I can see the fractional area change. I can see the injection fraction for the left and the right ventricle. I can see the global strain. I can see all those parameters, and I can actually check them from cycle to cycle. So this is, and again, like traditionally, this software exists for the children and adult, and it's very time consuming, requires picking the cardiac cycle, requires the checking and tracing. And, most of the people, then they see demo, they feel like, okay, it's not for me. So now you can be an expert, because the only thing that you need to get perfect 4-chamber view, and you need to push one button, and then all this information will be available for you. So, of course, I would like to mention very briefly that advances include the 3D imaging. So those technologies got faster. And again, this is traditionally something that is reserved for experts, now available for novice operators, because it's much easier to manipulate that volumes, and a lot of tedious and the difficult and time-consuming work is basically taken by the artificial intelligence, and it takes really seconds to get the images like that. So my talk would be not completed if I would not mention the first trimester cardiac imaging and the new development in our probes, and how the resolution of the transabdominal probes improved dramatically. So here is the quote from the different AIM guidelines. So this is detailed ultrasound in the first trimester between 12 and 14 weeks gestation. And I would like to thank Dr. Bromley for her tremendous effort to really put this together and organize that work, and now she is doing a lot to make it even to take it to the different levels. So those who are really believing in the first trimesters and doing them on the regular basis will be able to kind of charge for that, which is also important. But here you can see the axial plane, which is the foundation of our cardiac imaging at any gestation, and the required planes by that guideline. So here you can see that in the first trimester, closer to 14 weeks gestation, like 13 and a half, you can clearly visualize the four chambers, and you can clearly see all the anatomical landmarks that, again, the system can label for you, and everything that we discussed for the second trimester can be applied to the first. So also the advantage of the microvasculature type of the Doppler, this is the MV flow, is critical for the assessment of the heart at that early gestation. And you can see that you can visualize the septum, at least to confirm that it exists and doesn't show significant defects. You can identify the position of the aorta. You can see the pulmonary veins, and this fetus is just 13 weeks gestation. The other important view is the three-vessel and trachea view, and again, we can identify all these anatomical landmarks, including the pulmonary artery, the aorta, and the superior vena cava and trachea. This is, again, 13-week fetus, and we are using the transabdominal ultrasound, the appropriate optimization of the color. And again, this is the MV flow, so you can see the resolution of this technique that helps to see pulmonary artery, the aorta, the superior vena cava, the azygous vein that drains to the superior vena cava, and even the branches of the aorta, such as the internal thoracic arteries, which basically highlight the lateral borders of the developing thymus, so that the resolution and the details that we can see is really amazing. So, but we have a few minutes, and I would like to show you the clinical cases. So all what we looked at before, it was like the description of the technology and basically what we need to know. But now we are going to apply that knowledge to the specific clinical situation. So this patient was referred for the growth ultrasound, and here you can see pretty normal four-chamber view. You may argue that maybe the cardiac axis is deviated a little bit to the left and the heart looks a little bit bigger than you want it to be, but the baby showed some evidence of the growth restriction. So here you can see the outflow tracts. This is a mandatory view that need to be obtained every single time that we look at the heart at any gestation. And here clearly we have the diagnosis in 2D and the 3D. And I think that you agree with me that this is the easiest visualization of the transposition of the great arteries. And this is the anomaly that we absolutely cannot miss during prenatal time. So this is another very significant cardiac abnormality that represents the critical heart defect after birth. This is the hypoplastic left heart syndrome that develops as a result of the critical aortic stenosis. And you can see the specific features of the left ventricle and its globular not contracting, the echogenic endocardium. So this is really, really severe cardiac anomaly. And here I would like to highlight that this is something that we can use the 3D and reconstruct the same features of this heart defect. And in order to try that new software, I was able to apply that to this heart. And I was just curious if that AI really shows me what it's supposed to. And you can clearly see here that the injection fraction for the left ventricle is basically nothing. It's 3%, while for the right ventricle, it's 60%, and it's normal. And at the same time, the global strain, you can see that here on the curve that the left ventricle shows no strain, no motion, no deformation. So this left ventricle is done. It's not doing anything. It's not contracting. And you can see a very visual image of that together with the objective confirmation using the quantitative analysis. So this is something you probably can see without all those measurements, but there are people who like to put numbers on everything, in particular if it looks okay and then it doesn't. So that's why I think that this is very, very important technique to be familiar with. So the other challenging situation, the BMI of the mom is 54. So, and you may say that, well, this is not that bad. So the image is really looking okay for this type of challenge. And at least it helps us, like shows us very vividly that this is a major cardiac anomaly. But I just want you to make sure that you never give up to improve your image and do it first and then try to interpret, because the application of all these techniques, including the speckle reduction, so the clear vision, the HD vision, the application of um, mm, the the appearance of the 2D image as the 3D, which is the luminant technique. So this is all can help, to make the visualization much better. And I hope you can see the significant difference between these two images, and baby didn't change the position. So this is solely just the image optimization and application of those modern techniques. So another example that most of the time when we deal with the difficult patients, the color usually doesn't really work. So the new techniques allows us to penetrate and still have color really informative. That is really impressive. And this is not just the color Doppler, but also the spectral Doppler, which allows adjustment of the scale to visualize such a high velocities up to 3 meters per second without any aliasing. So this is also represents a significant improvement of our technologies. And of course, we can reconstruct this heart that has obviously the severe malformation of the tricuspid valve, severe tricuspid dysplasia that can be presented in the different types of the 3D surface rendering imaging. So, but some of these malformations are not that easy to diagnose. And this is the heart that was called pretty normal at 18 weeks gestation, with the exception of the small regurgitation on the tricuspid valve. And this is where the situation may develop later in the pregnancy. That's why there is a huge discussion about should we do the third trimester assessment routinely to pick up the situations like that. And this is the classic Epstein anomaly, the significant displacement of the septal leaflet of the tricuspid valve towards the apex. And here is the confirmation using the color Doppler and the spectral Doppler, and all the measurements that we can demonstrate the cardiomegaly, and we can directly measure the displacement of that leaflet. So, but this is a little bit more trickier case. So looking at this heart, you can see that it has abnormal shape, but you can't really see any anomalies per se. So what this heart has, it has severe myocardial dysfunction. And how we can judge that, because we are looking at the monophasic flow through the both EV valves, the significant tricuspid regurgitation, that indicates that this is the biventricular myocardial problem. We don't know what's causing that. So this was a really interesting observation. We also saw the significant abnormality of the ductus venosus blood flow, the reversal flow during atrial contraction, and all this was put together as these findings. And as you can see here, this is the first pregnancy for this patient. She had some sort of the cardiomyopathy that manifests the pretty early age with the chronic hypertension. And indeed, that assessment, and in particular assessment of the blood flow across the valves, help us to suspect the fetal cardiomyopathy. And after birth, that was confirmed not just on the baby, but on the mother as well. So they're carrying the same gene. And I would like to finish my presentation with this observation. I think that many of you are very skeptical about the 3D imaging. And this is a patient who I literally scanned yesterday, and her story was that she was a super stat. So her referral said stat, 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 ultrasound 5 times. And so the patient was told that the baby has the gigantic aneurysm of the descending aorta that may rupture at any time. So the patient was extremely upset, crying from the very beginning. And here you can see how the 3D ultrasound can help to solve this mystery. So we were able to diagnose the umbilical vein varix. And also I would like to demonstrate here, you can see the umbilical arteries, you can see the umbilical vein, you can see the varix, you can reconstruct all the structures related to the abdominal vasculature on that fetus. You can highlight for the patient where the aorta is, that it's really, that bulge not really has to do anything with the fetal aorta. And I think that this is really clearly demonstrates that the 3D, it's not just a pretty picture. It really makes a difference how you talk to the patient, how you kind of precisely diagnose the conditions, how you use that for counseling. And at the end of the day, this is what makes a huge difference in the clinical care. So, and with that, I would like to thank you for your attention. I would like to thank you, AIM, and the Samsung for the collaboration. And I hope that this type of bridge between the companies and the professional societies will be expanding. And I hope you like that type of the experience. And I will be more than happy to answer all the questions that you have now.
One of the questions earlier on in your presentation when you were showing all of the beautification of the image, but wouldn't it be imperative to see the image in its native, see the native part without the makeup? What's your answer to that? Rather than having all the applied technologies and enhancements to it, would you prefer viewing heart in that native appearance? Meaning without luminant, without MB flow, without multi-vision and clear vision. The question was, wouldn't you want to see the native heart, not the made up makeup looking heart?
Well, so I mean, I showed you the difference. So I showed you the example of the native picture and the picture, the enhancement. So I think that it's like the question of choice, but I think that for me, the native image not always performs very well. So like then I have challenging situations. So usually application of all these makeups, it's not just a pretty picture. That helps the improving the resolution, improving contrast, improving the details that I can see. So that's why those new technologies, they are not just aiming to give you the eye candy, right? So this is basically to fight the challenges that you may face. And the idea is that you may decide, well, I like the native image. If it's enough for your diagnosis, it's great. But if you cannot make the diagnosis and you need help, so this is where all the tools that you can utilize to try. I mean, sometimes this combination works, sometimes different, but at least you have a tools that are on your side to try. Then you already exhausted all the options, the regular imaging. And I think that this is the great option and things to know and kind of consider, so that you have a lot of helpers on the side of the machine, much more than we used to have. Like there are options. Room
Right,
for
I agree. Another question that is in the queue is, don't you think that 3D ultrasound with advanced Doppler modalities are used more widely by sonologists?
I mean, there is a lot of echoes. Can you repeat the question?
Oh, I'm sorry. The question is, don't you feel that it's time for the 3D ultrasound with advanced Doppler modalities be used more widely with the sonographers and sonologists? And I think you pointed that out, like that it is important to use the 3D appearance to make that diagnosis.
Well, I mean, can we make the diagnosis without 3D? Most of the time, yes. But what the 3D adds to the picture, it adds confidence that you know what you are seeing and what you think that is actually confirmed, and also it gives you better understanding of about the spatial relationship of this or that structure to others, so that it gives you like the virtually 3D orientation within the fetus. And again, this is great for overall confidence and accuracy of the diagnosis. And actually, I find it very, very helpful when you try to explain what you see and what we are dealing with to the patient. So that I think the great value of the 3D, and I hope that because the algorithms got much more simplified, and as I should mention, probably you heard over this talk over and over, easy flow, easy structure. So like things are getting easy. So this is really a huge step forward that the technologies are bringing to our life. And I think that also to the ultrasound, so that is everywhere, so that things are getting easy. And 3D is getting easy. It's not that difficult anymore. So I hope that, you know, sonographers, sonologists will use that more frequently.
Agreed. You have a bunch of accolades on your beautiful image quality and excellent images and excellent cases. There was a question if you have any suggestions on where people can get training in feed echo.
Uh, Training as a sonographers, or so like I can probably advertise here the training that we are providing to for the junior faculty and the junior MFM specialists. So here at EVMS, we have the 1-year program of the fetal cardiology. And if you're interested, please contact us, because we are recruiting 1 fellow a year. And this is specifically for physicians who are certified in MFM and who really want to dedicate their practice and learn more about the fetal hearts and how to manage pregnancies which are affected by the major cardiac anomalies and also the arrhythmias. So specifically for sonographers, I hope that we will put a lot of materials for just general cardiac imaging education in the future for AIUM website, and it will be available. So at least we have those plans. So please stay tuned. Oh yeah, so like the BMI of 54 kilos per square meters. Yes. That was the BMI of 54. The question was one image that BMI said 54 kilos. Yeah, so it's a typo. Kilos per square meters. Yeah, 54 kilos, that would be a delightful patient to scan, I think. Considering that 1 kilo is almost 2 pounds.
Okay.
The questions?
You have a lot of wonderful comments in the chat.
I see that. Thank you very
Yes.
much for everybody who said that. And it's always a pleasure to share my experience. And if you come up with any other questions, please don't hesitate to contact me, and I will be more than happy to answer more questions.
Thank you, Dr. Sinkoskaya. And you had a great presentation with beautiful images. And we'd like to thank Samsung for partnering with us to make this webinar possible. And a big thanks to all of you who joined us tonight. As a reminder, you will receive an email within 24 to 48 hours with a link to review the recording, and this will also be posted on the AIUM website. Lastly, when leaving this webinar, if you could go back to the activity in your AIUM account and take the brief survey, we would appreciate any feedback you could provide. We will use that to help us plan our future educational offerings. And with that being said, we will close out this webinar. Thanks again for joining us and have a great evening.